Do you have knee osteoarthritis and feel that exercise will make your knee pain worsen? You may have heard things like don't bend your knee too much, avoid squats, or even just rest your knee. But here's the important truth. For most people with knee osteoarthritis, the right exercise are not the enemy. They are an important part of managing the pain, improving the strength, and maintaining mobility. In this video, I will show you some of the best exercises for knee osteoarthritis, how to perform them safely, and commonly mistakes to avoid how to build a simple exercise routine at home. So watch until the end because I will also explain when knee pain during exercise is acceptable and when you should stop. Knee osteoarthritis is a condition in which the structure inside and around the knee gradually undergoes changes. It can cause knee pain, stiffness, difficulty in climbing the stairs, difficulty in getting up from the chair, reduced walking tolerance, swelling or discomfort after an activity, difficulty with daily activities. One of the biggest problems is that knee pain can make you move less. And when you move less, your thigh and hip muscles can become weaker. That can make everyday activities more difficult. So the goal isn't simply to rest the knee. The goal is to find the right amount and type of movement for your individual condition. Let's start with a very simple exercise. This is called the Quadriceps Sets. Your quadriceps are the large muscles at the front of your thigh, and strengthening them is an important part of knee rehabilitation. Sit or lie down with your leg comfortably straight. Place a small towel underneath your knee if needed. Now gently tighten the muscles at the front of your thigh and press back of your knee down towards the towel or the surface. Now hold for around 5 seconds, then relax. Repeat this around 10 times. Don't hold your breath and don't forcibly push your knee down. Next is the straight leg raise. This exercise helps strengthen the quadriceps without repeatedly bending and straightening the knee. Lie on your back. Bend one knee while keeping other leg straight. Tighten the thigh muscles of the straight leg. Then slowly lift the leg until it is approximately level with the opposite thigh. Hold briefly, then slowly lower it. The important word here is slowly. Don't swing your leg up and down. Control the movement throughout. This is one of my favorite exercises because you can do it on a regular chair. Sit upright with your feet on the floor. Slowly straighten one knee. Hold for a second or two. Then slowly lower your foot back down. Repeat on the other side. Keep your movement controlled. You don't need to force the knee into its maximum range. Now let's move to a very functional exercise. Sit to stand. Think about how many times you get up from a chair during the day. This exercise trains the muscles you need for that exact activity. Sit towards the front of the stable chair. Keep your feet approximately hip width apart. Lean your body slightly forward. Push through your feet and stand up. Then slowly lower yourself back into the chair. Try not to use your hands unless you need them for safety. And don't let your knees collapse inwards. If this is difficult, start with a higher chair or use your hands for assistance. Squats are often blamed for knee problems, but the issue is usually not simply squatting. It's about how much, how deep, how often, and whether the exercise is appropriate for your current condition. For knee osteoarthritis, you can start with a support mini squats. Hold on to a stable countertop or a sturdy support. Keep your feet comfortably and approximately hip width apart. Bend your knees slightly while pushing your hips backwards. Go only as far as feels comfortable. Then return to the standing position. Start shallow. You don't need to perform a deep squat to strengthen your muscles. Your knee doesn't work in isolation. Your hip and buttock muscles also contribute to how your leg moves and functions. That's why strengthening the gluteal muscles can be useful. Lie on your back with your knees bent and your feet comfortably positioned. Tighten your abdominal and buttock muscles. Then gently lift your hips from the surface. Pause briefly. Slowly lower back down. Don't arc your back excessively. Think about lifting through your hips rather than pushing your stomach upwards. Next, let's work on your calf muscles. Stand behind a sturdy chair or a countertop for support. Slowly raise your heels so you can come up onto your toes. Pause. Then slowly lower your heels. Keep your body upright and avoid bouncing. Step-ups are another functional exercise that can help prepare your legs for activities such as climbing the stairs. Start with low step and hold on to a secure support if necessary. Step up slowly. Straighten your body. Then carefully step down. Start with low height. You can gradually increase the challenge as your strength improves. If you have significant pain or difficulty with stairs, don't start with a high step. Strengthening is important, but maintaining flexibility can also help you move more comfortably. Here's a gentle hamstring stretch. Sit near the edge of a chair. Extend one leg forward with your heel on the floor. Keep your back relatively straight. Then gently lean forward from your hips until you feel a mild stretch behind your thigh. Hold for approximately 20 to 30 seconds. Do not bounce and don't force the stretch into pain. Strength exercise are only one part of knee osteoarthritis management. Regular, low-impact aerobic activity can also be very useful. Depending on your abilities, options may include walking, cycling, stationary cycling, swimming, water-based exercise. Start with a manageable amount. You don't have to suddenly walk for 1 hour. You might begin with a short period and gradually build your activity level. Now comes the question I hear all the time. How much exercise should I actually do? There isn't one perfect routine for every person with knee osteoarthritis. Your exercise program should depend on your pain level, your strength, your mobility, your age, and general fitness, your other medical conditions, your current activity level, and the severity of your symptoms. A practical starting point is to perform strengthening exercise 2 to 3 times per week with appropriate rest and gradual progression. But remember, more is not always better. Better is better. The goal is consistency and appropriate progression. Here's an extremely important point. Some people completely avoid exercise because they feel mild discomfort. Others push through severe pain because they think no pain, no gain. Neither extreme is ideal. With knee osteoarthritis, some mild discomfort during exercise may occur, especially when you are starting a new activity. But the pain that is severe, rapidly increasing, or accomplished by significant swelling or other concerning symptoms is a reason to stop and reassess. And if your symptom consistently worsen after an exercise, your program may need to be modified. Don't simply assume that every knee pain is osteoarthritis. You should seek professional medical assessment if you have a major injury, sudden severe pain, significant swelling, a knee that becomes very red or hot, fever with a painful or swollen knee, inability to bear weight, a knee that repeatedly gives away, a knee that becomes locked, or symptoms that are progressively worsening. And if you already have diagnosis of knee osteoarthritis, but aren't sure which exercise are appropriate for you, an individualized assessment can make your exercise program much safer and more effective. Let's quickly discuss some common mistakes. Mistake number 1. Doing too much too soon. Don't go from almost no exercise to an intense workout overnight. Mistake number 2. Ignoring the technique. Good technique is important than doing 50 repetitions. Mistake number 3. Only exercising when pain disappears. Waiting for the knee to become completely pain-free from moving can sometimes keep you inactive for too long. Mistake number 4. Doing only knee exercise. Don't forget your hips, thigh, calves and overall cardiovascular fitness. Mistake number 5. Expecting overnight results. Strength and functional improvements take time. Consistency beats intensity. If you are looking for a simple starting point, here's an example routine. Start with warm-up, 5 to 10 minutes of comfortable walking or gentle movement. Then go for strengthening, Quadriceps Sets, 10 repetitions, straight leg raise, 8 to 12 repetitions, seated knee extension, 10 repetition, sit to stand, 5 to 10 repetition, gluteal bridge, 8 to 12 repetition, calf raises, 10 to 15 repetitions. Then finish with gentle stretching. But remember, this is a general educational example, not an individualized prescription. Your ideal exercise program may be different. If you remember only one thing from today's video, remember this. Knee osteoarthritis does not automatically mean you should stop moving. The right combination of strengthening, mobility work, aerobic exercise, and activity modification can help you maintain function and improve your ability to perform everyday activities. Start at your current level, progress gradually, and listen to your body. If you found this video helpful, please like this video and subscribe to my channel for more evidence-based information about knee pain, rehabilitation, occupational therapy, and healthy aging. And tell me in the comment section which activity is hardest for you because of knee pain, walking, climbing the stairs, squatting, or getting up from a chair. Your answer may help me decide what topic to cover in the next video. Thank you for watching and I will see you in the next video. Move better, stay strong, stay independent. Subscribe for more rehabilitation and health education. Thank you.